Everybody, this is Dr. Stephen Phillips. I'm here to talk about the apparent Herxheimer's from hell that don't get better. If this happens, it's most likely that there's blebbing involved. Blebbing is a phenomenon where bacteria shed pieces of themselves in response to stress, and it's known to occur with certain bacteria like spirochetes, like Lyme, and it's also known to occur with Brucella, which is a cousin to Bartonella. Everything that Brucella does, pretty much Bartonella does as well. And in Bartonella patients, because like Brucella, it's an inherently antibiotic resistant organism, we see this phenomenon much more frequently of extended Herxheimer's and difficult to treat through Herxheimer's. And really, there's a lot of blebbing going on. So again, blebbing is when the bacteria shed pieces of themselves in response to stress, and those pieces look to the immune system like the whole bacteria. It ends up in a lot of excess immune stimulation. That's the net product is that it causes increased symptoms and doesn't necessarily result in the death of the bacteria. So if a bacteria gets stressed out by antibiotics but never gets to the other side and gets killed by those antibiotics, you can result in a long-term flare of symptoms without actually moving the patient forward. And that's an unfortunate observation that we see in sometimes with Bartonella patients. So something else that we see is a phenomenon where people go off antibiotics, even if they've done relatively well, had a relatively short Herxheimer and gotten better, they'll often flare up temporarily when the antibiotics are removed. And how do we explain that? I think that's a blebbing response also. I envision it this way, that the antibiotics kill some bacteria, they paralyze others. The ones that are paralyzed when the antibiotics are removed, I just think that if someone had a straitjacket on me for a couple months, I get a little bit wild when the straitjacket was removed, and I think that the bacteria have another stress response when the antibiotics are withdrawn and temporarily bleb as well. And we see this a lot, where you get this kind of two-humped kind of pattern. People get a Herxheimer, they start to feel better, and when the antibiotics are taken away, they get a second flare that's also transient.